All of you. Myself, Dr. Majid Khan, Associate Professor located Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. I welcome all of you in this lecture 2 of antibiotic, that is bacterial resistance and beta-lactamase inhibitors. In previous lecture, we were covered the nomenclature and SAR of penicillin. So in this video, that is in lecture 2, we will cover bacterial resistance and beta-lactamase inhibitor drug. Learning outcome: after completion of this topic, student able to understand the bacterial resistance towards the penicillin, and it also able to understand strategy of using beta-lactamase inhibitor in combination with beta-lactamase sensitive penicillin along with mechanism of action. So first is bacterial resistance. Some bacteria, especially gram-negative bacteria, are naturally resistant to action of penicillin. The best understood and most important biochemical mechanism of penicillin resistance, the enzyme that inactivate penicillin. Such enzyme which have been given the non-specific name penicillinases, and there are two general types, that is beta-lactamases and acylases. By far more important of these are beta-lactamase enzyme that catalyzes hydrolytic opening of beta-lactam ring of penicillin to produce inactive penicilloic acid. So generally bacteria contain enzyme, generally name is given penicillinase. So there are two types of penicillinases enzyme which is present in bacteria. First one is beta-lactamases and second one is acylases. But here the important one is beta-lactamases. So here the reaction is given how this beta-lactamases enzyme causes hydrolysis of penicillin into penicilloic acid. So it is the general structure of penicillin. So enzyme that is beta-lactamases which is present in the bacteria. This beta-lactamases enzyme contain CH2OH group, that is hydroxyl group. So here CH2O minus act as a nucleophile. It attack to this carbonyl carbon of beta-lactam ring. So beta-lactam ring means this 4-member ring is called as beta-lactam ring. So here CH2O minus, which is a part of beta-lactamase enzyme, attack to carbonyl carbon of beta-lactam ring, and it causes breaking of carbon nitrogen bond as shown by the arrow. Then it become N minus, then this hydrogen from this CH2OH attached to nitrogen. So by this way there is a complex of penicillin and beta-lactamases enzyme. So by this way beta-lactamases enzyme attack to beta-lactam ring. Then there is a removal of water molecule, or there is a separation of enzyme. So here there is a breakage, water molecule is added, OH added above side and hydrogen added toward the enzyme side. So this bond is break, water molecule added, then it forms the penicilloic acid, and again the enzyme is free for further attack. So in short, beta-lactamase enzyme which is present in bacteria attack to the beta-lactam ring and it form penicilloic acid. So here there is a breakage of this beta-lactam ring and the enzyme again separated, which is ready to attack the another molecule of penicillin. So it is a reaction which show how beta-lactamase enzyme attack to beta-lactam ring of penicillin and convert penicillin into penicilloic acid. Beta-lactamases produced by gram-negative bacilli appear to be cytoplasmic enzymes that remain in bacterial cell, whereas those elaborated by Staphylococcus aureus are synthesized in the cell wall and released extracellularly. So it is the main reaction how beta-lactamase enzyme deactivate the penicillin. Now, specific acylase, that acylase enzyme, which is second enzyme present in bacteria, that hydrolyzes the acyl amino side chain of penicillin, have been obtained from several species of gram-negative bacteria, but their possible role in bacterial resistance has not been well defined. These enzymes find some commercial use in preparation of 6-APA, aminopenicillinic acid, for the preparation of semi-synthetic penicillin. So another enzyme that is called as acylase, which attack this side chain. So there is no defined mechanism of this enzyme, but it attack to this side chain. So this enzyme is utilized to prepare the commercial use in preparation of 6-APA, aminopenicillinic acid. So it is a commercial form of penicillin for preparation of new semi-synthetic penicillin. Another important resistance mechanism, especially in gram-negative bacteria, is decrease the permeability to penicillin. The cell envelope in most gram-negative bacteria is more complex than in gram-positive bacteria. It contains outer membrane not present in gram-positive bacteria, which create a physical barrier to the penetration of antibiotic, especially those that are hydrophobic. A small hydrophilic molecule, however, can transfer the outer membrane through the pores formed by protein called as porins. Alteration of number of or nature of porine in the cell envelope also could be important mechanism of antibiotic resistance. So it is about the bacterial resistance. So the important reaction is this reaction of, that is, beta-lactamase enzyme attack to beta-lactam ring and converted into penicilloic acid, and acylase enzyme, it attack on the side chain of penicillin, and it is used in preparation of 6-APA. So it is about the bacterial resistance. Now the important point here, so now the next topic, beta-lactamase inhibitor penicillin. So it is an important topic in exam. Number of times this question asked, that is short note on beta-lactamase inhibitor. So as name indicate, these are the drugs which inhibit the beta-lactamase enzyme of bacteria. So here the strategy of using beta-lactamase inhibitor in combination with beta-lactamase sensitive penicillin in therapy for infection caused by beta-lactamase producing bacteria failed to live up to its obvious promise. Early attempt to obtain synergy against such a resistant strain by using combination consisting of beta-lactamase resistance penicillin like methicillin, oxacillin as a competitive inhibitor, and beta-lactamase sensitive penicillin like ampicillin and carbapenicillin to kill organism met with limited success. So here the strategy. So for this topic, here we divided the penicillin into 3 classes for this topic. First, that is beta-lactamase sensitive penicillin. So these are the penicillin which not work in presence of beta-lactamase enzyme. In other words, it is called as beta-lactamase sensitive penicillin. So in presence of beta-lactamase enzyme, this penicillin not work. So example in this category is ampicillin, amoxicillin, carbanicillin, penicillin G and penicillin V. Second type, beta-lactamase resistance penicillin. So beta-lactamase resistance penicillin means these are the penicillin which is not affected by the beta-lactamase enzyme. So beta-lactamase, in presence of beta-lactamase enzyme, these type of penicillin work. Example, methicillin, oxacillin, cloxacillin, napsicillin. So these are the example of beta-lactamase resistance penicillin. Now third one, that is beta-lactamase inhibitor, also called as mechanism-based inhibitor. So these are the drugs which attack to the beta-lactamase ring and block this beta-lactamase ring for longer period of time. In that example is clavulanic acid, sulbactam and thinamycin. So here there are three types: beta-lactamase sensitive, beta-lactamase resistant, beta-lactamase inhibitor. So previously, if we see the history, previously beta-lactamase sensitive penicillin used alone, but when it is used alone, it does not work in presence of beta-lactamase enzyme, because beta-lactamase enzyme attack to this type of penicillin and inactivate it. After some year, combination therapy is used. This combination consists of beta-lactamase sensitive penicillin plus beta-lactamase resistance penicillin. So first two class given in combination previously, but this combination is fail. Why this combination fail? There are four reasons how this combination is fail. First reason is fail to penetrate the cell envelope. So the second type, that is beta-lactamase resistance penicillin, fail to penetrate the cell envelope of gram-negative bacteria. So when we given alone beta-lactamase sensitive penicillin, then it easily inactivated by the beta-lactamase enzyme and therefore does not work. But if we give the combination, that is first two class, beta-lactamase sensitive penicillin plus beta-lactamase resistance penicillin, when given in combination, previously it is act in good manner, but after some year this combination is fail. So here the reason why this combination is fail, because beta-lactamase resistance penicillin fail to penetrate the cell envelope of gram-negative bacteria, then reversible binding to beta-lactamase, and therefore high concentration is required. So second class beta-lactamase resistance penicillin, it bind to beta-lactamase enzyme, but there is a reversible binding, and for binding it require in higher concentration. Third reason, induction of beta-lactamase by some penicillinases resistance penicillin. So bacteria produce the resistance against these two combination. So it is the reason why first two class combination is fail. Therefore, to avoid this, new drug is developed, that is called as beta-lactamase inhibitor, or also called as mechanism based inhibitor. So the discovery of naturally occurring mechanism based inhibitor, clavulanic acid, which causes potent and progressive inactivation of beta-lactamase enzyme, has created renewed interest in beta-lactam combination therapy. This interest has led to design and synthesis of additional mechanism based beta-lactamase inhibitor such as sulbactam and tozobactam, and isolation of naturally occurring beta-lactam such as thinamycin, which both inhibit beta-lactamase enzyme and interact with penicillin binding protein. So after failure of combination of beta-lactam sensitive penicillin and beta-lactam resistance penicillin, a new class of drug is developed, that is called as beta-lactamase inhibitor, or called as mechanism based. Example of this category is clavulanic acid, sulbactam, thinamycin. So here there are two types of beta-lactamase inhibitor. First class, that is called as class 1. So here the example of class 1 is tozobactam, clavulanic acid and sulbactam. So class 1 inhibitor that have heteroatom leaving group at position 1. So this class 1 class of the beta-lactamase inhibitor, in that these all drugs contain heteroatom at position 1. For example, in case of tozobactam, here sulfur is there. In case of clavulanic acid, oxygen is there. In case of sulbactam, again sulfur is there. So beta-lactamase inhibitor have two types. First one is class 1. So in class 1, the drug contain heteroatom at position 1. Example is tozobactam, sulbactam, clavulanic acid. Then in class 2, so it is the example of class 2. So these drugs do not contain heteroatom leaving group at position 1. So if you see here, there is no heteroatom present. Here is a carbon atom. Same here, carbon atom is present. So these are, it is called as class 2 inhibitor which does not contain heteroatom on position 1. Example of this class is thinamycin, imipenem, meropenem. Then other type of classification. So these are the main class 1 and class 2. But there are other chemical classification of beta-lactamase inhibitor is, first one is oxopenum. Example clavulanic acid. Second, penum sulfoxide, that is example sulbactam, tozobactam. Then carbapenem, example thinamycin, imipenem. So it is another type of classification, but the drug is same. Now the question may ask, or many times the question were asked, that is clavulanic acid called as a suicide substrate, just justify. So the answer of this is given here. So question is clavulanic acid, which is a beta-lactamase inhibitor drug, why it is called as suicide substrate, justify. So for a normal substrate, that is when beta-lactam penicillin, that is called as beta-lactamase sensitive penicillin, interact with beta-lactamase enzyme, there is a formation of acyl enzyme intermediate which radially undergo hydrolysis and destroying the penicillin and free the enzyme to attack more penicillin, as we already seen how penicillin is hydrolyzed. Then but the acyl enzyme intermediate formed when mechanism based beta-lactamase inhibitor is attacked by beta-lactamase enzyme is diverted by tautomerism to more stable imine form that hydrolyzes more slowly to eventually free the enzyme, that is called as transition inhibition. Or for class 1 inhibitor, second group on enzyme may be attacked to inactivate it. Because these inhibitors are also substrate for the enzyme that they activate, they are sometimes referred as suicidal substrate. Because class 1 inhibitor causes prolonged inactivation of certain beta-lactamases, they are particularly useful in combination with beta-lactamase sensitive penicillin to treat infection caused by beta-lactamase producing bacteria. These such inhibitors are clavulanic acid, sulbactam, tozobactam are currently marketed. So here the point is, if we see the mechanism of this type of drug, so why it is called as suicidal substrate. So when we use beta-lactamase sensitive penicillin, example penicillin G, penicillin V, these are called as beta-lactamase sensitive penicillin. Beta-lactamase sensitive penicillin means these are the penicillin which is easily hydrolyzed by the beta-lactamase enzyme of bacteria. So here the reaction, if we see this straight reaction, this one, straight reaction is for the beta-lactamase sensitive penicillin. Suppose if we consider this structure is beta-lactamase sensitive penicillin, then it is the enzyme that is called as beta-lactamase enzyme. So here there is this enzyme attack to this beta-lactam ring as we seen previously. So this enzyme O act as a nucleophile. So it attack on this beta-lactam ring. So this bond is break here. So here carbonyl carbon is attacked by this enzyme, then this CN bond is break like this. So here the enzyme is attached. Enzyme attack to the beta-lactamase is sensitive penicillin. Then this, it is called as intermediate. This one is called as, sorry, this one is called as intermediate. Now after attack, then again here hydrolysis taken place. Water molecule added here and this bond is break. Again enzyme separated and there is a hydrolytic product. So beta-lactamase sensitive penicillin attacked by the beta-lactamase enzyme of bacteria, and it easily hydrolyzes in very less time. So this straight reaction is for the beta-lactamase sensitive penicillin. But if we given this type of drug, that is beta-lactamase inhibitor, so if we consider this compound act as a beta-lactamase inhibitor, so first step is same, enzyme attack to this drug, but here there is a diversion of reaction. So if we see the above reaction here, arrow is given, so here hydrogen is removed, then this bond is shifted here, it become double bond, this X and carbon bond is break, and we get this type of intermediate. So this arrow is shown for this product. So if we consider this compound as a beta-lactamase inhibitor drug, so if we consider this compound as a beta-lactamase inhibitor drug, then the first step is same, but here second reaction is diverted here. Similarly below, if we see the below, there is a tautomerism. How this tautomerism? So here this hydrogen from nitrogen shifted to this carbon and this double bond shifted to here like this. So it is a tautomerism and this is called as transition inhibition. And then after removal of water molecule from both sides, here there is a formation of hydrolysis product. So in short, here beta-lactamase inhibitor drug just divert the pathway. It just divert the pathway through the tautomerism or through this transition state. So if we given the combination of beta-lactamase sensitive penicillin and beta-lactamase inhibitor drug, then this beta-lactamase inhibitor block this beta-lactamase enzyme for a longer period of time due to this diversion reaction, and therefore this enzyme beta-lactamase enzyme block for more time, and beta-lactamase sensitive penicillin does not degraded by this beta-lactamase enzyme, and therefore they give their action. So in summary, beta-lactamase inhibitor just block this beta-lactamase enzyme for a longer period of time by this diversion reaction. Due to blockage of this beta-lactamase enzyme for a longer period of time, the normal penicillin, that is beta-lactamase sensitive penicillin, does not affected by this beta-lactamase enzyme, and therefore it act in good manner and produce their effect. So in short, if we give only beta-lactamase sensitive penicillin, then it does not work for sufficient period of time because it easily attacked by beta-lactamase enzyme. But if we given the combination of beta-lactam sensitive penicillin and this type of drug, that is beta-lactamase inhibitor drug, so when these two drugs are given in combination, then the beta-lactamase inhibitor drug block this beta-lactamase enzyme for a longer period of time due to this diversion reaction, and therefore beta-lactamase enzyme block for longer period of time, and penicillin, the beta-lactamase sensitive penicillin work as a antibiotic because it does not affected by the beta-lactamase enzyme, which is already blocked by the beta-lactamase inhibitor. So it is the mechanism how these two drugs now given in combination. So if we in market there is a combination of these two type of drug, that is beta-lactamase sensitive penicillin and beta-lactamase inhibitor. For example, amoxicillin and clavulanic acid combination available in market. So it is the mechanism of this type of class. So example of this type of drug is clavulanic acid. So it is the structure of clavulanic acid, which is a beta-lactamase inhibitor or called as mechanism-based inhibitor. So structurally it is a oxopenum lacking 6-acyl-amine side chain of penicillin but possessing 2-hydroxyethylidene moiety at carbon 2. So if we see the structure, there is a no side chain on this position, but here on second position there is a 2-hydroxyethylidene moiety. Combination of clavulanic acid and amoxicillin are available in various fixed dose oral dosage form intended for skin, respiratory, ear, urinary tract infection caused by beta-lactamases producing bacteria. The clavulanic acid also used in combination with ticarcillin in fixed dose injectable form. Here the one point is regarding clavulanic acid and this type of drug, beta-lactamase inhibitor drug, when it blocks the beta-lactamase enzyme, then it self-destroyed. So when it reacts with beta-lactamase enzyme, this clavulanic acid self-destroyed, therefore it is called as suicidal substrate. So it makes suicide to prevent the beta-lactamase sensitive penicillin. When it given in combination, beta-lactamase sensitive penicillin plus beta-lactamase inhibitor, when given in combination, this clavulanic acid react with beta-lactamase enzyme and prevent the beta-lactamase sensitive penicillin from the beta-lactamase enzyme. And this clavulanic acid, while reacting with beta-lactamase enzyme, it self-destroy, and therefore it is called as suicidal substrate. Now next example of this category, sulbactam. So it is the structure of sulbactam. It is a 1,1-dioxopenicillinic acid. It have weak intrinsic antibacterial activity but potentiate the activity of ampicillin and carbonicillin against beta-lactamases producing bacteria. Fixed dose combination of ampicillin and sulbactam marketed under the trade name Unasyn. It is a trade name Unasyn as a sterile powder for injection have been approved for use in United States. And last example of this class, tozobactam. It is a structure of tozobactam. Tozobactam is a pharmaceutical drug that inhibits the action of bacterial beta-lactamases. Tozobactam is combined with extended spectrum beta-lactam antibiotic piperacillin in the drug piperacillin tozobactam combination used in infection due to Pseudomonas aeruginosa. Tozobactam broadens the spectrum of piperacillin by making it effective against organisms that express beta-lactamases and would normally degrade piperacillin. So it is about the beta-lactamase inhibitor, or also called as mechanism-based inhibitor. So if short note ask in exam, then first you have to view the concept how this type of drug is called as suicidal substrate and how the combination is used. It is used in combination with beta-lactamase sensitive penicillin along with their mechanism of reaction. So it is about the beta-lactamase inhibitor. Now you should remember, all the students should remember the example of penicillin, that is which type of penicillin is orally active, which type is parenterally active. So here is given, that is example of drugs. For example, oral penicillin. So ampicillin, amoxicillin, oxacillin, dicloxacillin, it is given orally, therefore it is called as oral penicillin. Then parenteral penicillin, in that penicillin G, methicillin, napsicillin, carbonicillin, ticarcillin. Then beta-lactamase resistance, that is methicillin, napsicillin, oxacillin, cloxacillin, dicloxacillin. Then acid stabilized means these are the drugs which are stable in acidic pH of stomach. Example, penicillin V, ampicillin, amoxicillin, oxacillin, cloxacillin, dicloxacillin. Next is acid unstable or acid sensitive, means in presence of acid this type of antibiotic is breakdown. Example, penicillin G, methicillin, napsicillin, carbonicillin, ticarcillin. Then beta-lactamase inhibitor, as we seen, clavulanic acid, sulbactam, tozobactam, thinamycin. Combination therapy, ampicillin plus sulbactam, picarcillin plus clavulanic acid, ampicillin plus clavulanic acid. So you should remember these examples. Sometime in exam, directly question asks short note about the oral penicillin, short note about the acid stabilized penicillin, short note on the beta-lactamase resistance penicillin. So you should remember the example of drug which use orally or parenterally, or it is an example of beta-lactamase resistance, etc., etc. So it is about the penicillin. So if you like the video, then subscribe the channel. Thank you very much.